the reproductive system of a female is so selective, so selective. And if whatever thing that is trying to implant itself does not have the qualities that are needed or that is needed, the uterus will reject it. And that is where we find out that there is miscarriage. Do you understand? You can use Clomid from now to tomorrow. Funny enough, Clomid may not work. In the aspect of bringing about pregnancy, Clomid may fail you. Now, before we even think of Clomid as that final option that we resort to when we are really desperate to get someone pregnant or to make someone get pregnant, we need to understand that Clomid also have certain grounds on which it functions properly. You may have to see the previous video I made last time so that it will guide you through, even when you're, because many people, they just know that, okay, this drug, it does this, and after the doctor must have prescribed it the first time and they feel that they need it the second time, they don't even consult the doctor anymore, so they just jump into the drug and keep taking it. Go back to the previous video and see what I stated there. Okay, so back to what we're talking about. I am Nurse Kamsi Norma, and this is Sexuality and Health Wellness, where we leave no crumbs behind. So far it is existing, we talk about it, and so far it is about sexuality and health wellness, oh shit, we talk about it. All right, I mean, you don't just do the whole thing and not smile, at least, happy. Okay, so back to the main thing now. Why did I make such statement earlier about Clomid not being that sure banker that, pregnancy is gonna come? We need to before you use a drug, you need to understand what the mode of action of this drug is. And the mode of action of Clomid, what it does is it brings about a situation where ovulation takes place. But for pregnancy to occur, it is not just centered on ovulation alone, right? It is not just centered on ovulation alone. There are many other things that have to be in place for pregnancy to take place in a woman. So these are the things that you have to consider before you say, oh, but I'm taking Clomid. Why is Clomid not doing anything? Why is it that blah 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 blah? Now listen, apart from you having the ovulation, apart from you having the eggs, apart from you eating healthy and all that, we also have to check the man. What is the quality of sperm of the man? Is the man potent? Is he expelling or ejaculating a healthy set of sperm? Does he live a healthy lifestyle? Because when it comes to this pregnancy of a thing, people only, especially the Africans like me, they only center, they are only concerned about the woman. They're only concerned about the woman. Hey, okay, hey, Vivian, did you do this? Did you do taking this drug? Did you do this? Taking traditional drugs and other supplements, whereas the man crosses his legs and it's like, how much is this thing? He pays. It is not all that there is to it. Okay, so in as much as the man is being supportive, the man also has to get into that process of checking himself. Then another thing is, I just want to talk about one disease condition apart from PCOS, which everybody knows. Now listen, in the situation whereby a woman has this condition called hydrosalpinx, which maybe we'll look into it better next time, it's very hard for this woman to conceive with such condition. Very hard. So you don't try to decorate a room that is obviously dirty. You need to get rid of the dirt before you establish decorations. So let's just say that Clomid is that decoration and you're trying to put it on a room that is already dirty, obviously dirty. It's not gonna work. It's not gonna bring out any beauty in there. So you just have to take your time, clear the room. Then you can introduce your decoration, and that is when we'll see the beauty of the room. Do you get my gist? Next, we look at the age. Now, when we say Clomid, the mode of action of Clomid is in such a way that it establishes ovulation. It brings about a situation where ovulation is, the chances of ovulation is actually high, right? Now, in cases of women that are about 35 to 40 to 50, which 50, everybody is like menopause, right? But okay, 35 to 40, and this woman is trying to conceive and is taking Clomid therapy. Now, you have to understand that as you're getting older, the quality of your egg is decreasing. Yes, I made a video about women that are 35 and trying to conceive. You can go see the video if you want. It's best to see it because you get to understand that the egg, when we talk about egg, there is more than the eyes meet when it comes to the female reproductive system, right? There is more than what you know. So you can go see the video. So now, women that are from 35, at least 35 to 40, these women, the quality of their eggs depreciate. Yes. So even if ovulation occurs, we find out that the kind of egg, because listen, ovulation does not just take place like out of the blues. No, ovulation takes place when there is a matured egg. And when the matured egg comes out, there are things that needs to be put in place before fertilization takes place. Implantation as well takes place. And one of those things are, apart from the egg being matured, does the egg have those chromosomal qualities that is needed? Does it have it? So these are the things that the uterus is so selective. The reproductive system of a female is so selective, so selective. And if whatever thing that is trying to implant itself does not have the qualities that are needed or that is needed, the uterus will reject it. And that is where we find out that there is miscarriage. Do you understand? So now, my dear people, if you are 35 to 40, 50, and you're trying to make use of the Clomid therapy, I just want you to know that it's a 50, in fact, let's be honest, it is 60-40 chance. Yes, it's a 60-40 chance, and of course, if God just wanna perfect a miracle, and we see it happening. But in that case where somebody is 40 and trying to it's a bit like I said, it's 60-40, and there is high possibility that even the matured eggs that are ovulated does not meet the chromosomal ability or chromosomal quality, and in other words, the uterus will reject ASAP. Yes. So now, I believe I am opening your eyes to see things that can make the whole Clomid stuff not to work really, right? You're saying that. Okay, now, in case you want to do or you want to go for Clomid therapy, or your doctor is suggesting you go for Clomid therapy, there is no, listen guys, nobody knows it all, and there are times that you need to bring some suggestion to the table, and your doctor will also have to scrutinize, right? And it might interest you to know that sometimes, just sometimes, your suggestions may be wonderful. And even in the treatment of patients, we, the healthcare practitioners, we need your cooperation. We need you to speak up. We need you to talk about your concerns, even when we are the ones that are pioneering that treatment. We are the ones that are bringing that treatment. We are the ones that know better, right? But we also need you to step into the game. So don't just feel so, I paid the doctor so he should know what to do. No, not just that. You also have the right to ask, okay, what does this do? It does da 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 da. All right. But what if, because da 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 da, okay? And your doctor is like, yes, I know this, but if we do it like this, da 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 da. And then you're seeing the reason why you cannot do this or you cannot do that. And maybe your doctor is even assuming things that should not be. And he will see the intelligence, or he will see the truth in what you're saying. You may not really be straight to the point, but it may give him an idea that, okay, this will work better if we add this to the Clomid treatment, to the Clomid therapy. And you are the one that's going to enjoy it. So don't just go through YouTube videos talking about Clomid therapy and how you should take Clomid and then you rejoice and then jump out and start taking Clomid. No. Even when you know about Clomid, you know about other drugs and all that. Be very, very, very patient. In other words, you're the one that is going to enjoy at the end of the day, because you're going to get your treatment full package without any slash in the treatment options or in the treatment regimen. Okay, so I believe you understand what I just stated here, and of course you have added another knowledge to the ones you have already. I'll see you in my next video. I love you, and of course I wish you get pregnant very soon.